everybody. Welcome to the Dental Handoff. I'm Dr. Kelly Tanner, and today I have with me Julie Varney. Julie, you are an amazing dental assistant, and I love running into you at the shows. And you're just, what I love about you is that you're so relevant and you're real, and I feel like you're connecting with your audience and everybody that you talk to. Stuff that's like real concerns that you're bringing solutions for.
Well, hello, everybody. I'm Julie. It's a lifelong passion, shall I say. I feel like sometimes we find our way into dentistry. We're not going to set out to be like, oh, I'm going to work in dentistry for the rest of my life. I feel like we find our pathway, whether it's being a dental hygienist, a dental assistant, a dentist, lab tech. It finds us and kind of we gravitate and pull towards it. I've been a dental assistant for 33 years. I didn't set out to be a dental assistant. I actually set out to be a hygienist. And that plan did not work out. And which I'm looking back at it, I'm totally fine with. Like, I am glad I made the choices that I have, but it wasn't a easy path journey. And there was a lot of roadblocks, as you know, in your profession. There's a lot of stumbles and turns and pathways that we can take.
Yeah. It's, I think, of course, I asked the question for everyone, why dentistry? And some people find that it's something that they fell in love with really early, or some people are like, I don't know. I just, like you said, to your point, you stumbled on it. So for you, Julie, when you wanted to be a hygienist, what made you flip and say, I really love being a dental assistant? For you?
Well, I became pregnant at 18 in my second semester of hygiene school, and I didn't know how I was going to support myself, and I couldn't finish right at the time. I'm like, well, I'll go back to it. And my colleague said, well, why don't you be a dental assistant? You can work right on the job. You can get trained on the job. You have a year of hygiene school, which is really not much, but I had that. So I found a job office that was hiring, and there I stayed. I never looked back. I never just said, you know what, I really miss being a hygienist. I didn't. I fell in love with the profession. I think because it was so hands-on and I could learn as I go. It was very repetitive. I'm not a bookworm. It takes me a lot to learn something from a book. But if you show me how to do it and the purpose behind it, I grasp it a lot better. Yeah. So I just stuck with it. And back, in 1992, 93, there wasn't social media. There wasn't things you could go watch on YouTube. You had to learn from others. You had to attend courses. You had a doctor that would hope to teach you. I had a fellow dental assistant that was a dentist in the Philippines, and she kindly helped me learn all those things. So it was really a self-learning profession back then, because you really had to push yourself. You couldn't just watch a video for 30 seconds like, oh yeah, I got this, or attend a course all day and be like, oh, I'm going to master this tomorrow. There wasn't that,
So true. We take for granted now that we can just, watch something and learn it right before we go into the procedure.
Yeah, well, that's the thing.
Not everything, but we can learn how to open something.
But nowadays there's so many good platforms with education at your fingertips. So we just installed 3D printing at the office, and I am watching YouTube videos, and I literally in 20 minutes learned how to print a model. I mean, it was that simple. I didn't have to read it. I just, and the video that I watched was awesome. It's just amazing the amount of technology and education out there is for anybody in the dental profession to be better than the next day, than the day before. So,
right. If you're interested in going that way, but it's like to your original point, before there was all of that, you had to find it in yourself to want to learn, to want to do better, to look up something, to talk to someone, to have the courage to ask someone about something that you feel like you probably should have already known how to do sometimes, which can be very uncomfortable.
And it is uncomfortable. And if you don't have, shall I say, like a good in-office mentor, someone that's like, oh yeah, you got this, you can do this. and they're uplifting you. They're not putting you down. Some offices aren't like that. I mean,
True.
you've heard stories from, other ones in your profession that, it wasn't the best experience to learn in or to evolve in.
Right.
And that can be hard, and that can either make or break you basically from this profession. Like, oh, we're not valued. I want to be paid more, but I can't get there. It's very, sometimes can be disheartening.
Yeah. What I thought was always cool about being a dental assistant is that you can, how do I say this? You can kind of choose what you love to do, like cosmetics or oral surgery or
Mm-hmm.
um, implants or, ortho or, you could, there is such a buffet of directions that you can go in. I mean, and some assistants say, I want to be a hygiene assistant as well. And so they get that cup filled if they have wanted to be a hygienist or if they're trying to learn how to go into that, or they want to start out chairside to learn more about going back to school to be a dentist or whatever.
Yeah.
And I think that that is so cool to have that opportunity.
And I do see where a lot of people think it's a stepping stone to be a dental assistant because it might funnel into you being a hygienist or a dentist. It is, but we have 8 specialties that we can work in and kind of master. And if I don't like it, I can always go to another office.
So
I mean, that's what's so nice, the flexibility and versatility of it is that if I don't like working in general one day and I want to dip my toes in peds, I can look for an office that's hiring and be like, okay, I'm going to go work in peds for a while. Or if I don't like peds, I can go work in endo. If I don't like endo, I can go work in ortho. I mean, there's such a vast array of things we can do. Whereas if you're a hygienist, you don't really have that like flexibility. You can maybe own your own practice, which would be awesome,
mhm,
or work in a perio office, but you're not going to work in an endo office.
right,
You're going to work in an oral surgery. I mean, sometimes they might hire a hygienist for endo or oral surgery and ortho,
right,
but most of the time your lane is going to be in general or your own practice or perio. So
yeah,
or maybe another type of practice, maybe like implant, just basic implant, like that's all they do is implants. So
right.
it's very versatile that if you don't like it or you get frustrated with it, there's an office up the road that's going to be hiring that you can dip your suction into, shall I say.
Do you find it like when you're talking to someone who's interested in getting into dental assisting, do you usually say start off at a general practice, or what do you recommend for them, Julie?
I say start off in general because you'll see a little dabble of everything.
Mhm.
Because I know that most general dentists nowadays do a little bit of everything. They're doing implants and they're doing extractions and they're doing root canals within their scope and their comfortability. I know my practice, we do it all because we're the only dentist, we're a very rural practice. So I always say start in general because I think you get to see exactly like, oh, I don't like root canals. I'm not going to work in an endo.
Right,
Or I love perio. I'm going to go work in a perio office. Or, I like ortho. I like the hands-on, kind of like having your own schedule. Like, most orthodontics, the assistant has their own column and they're doing most of the work. So I say start in general because then you get the kind of the foundation of what's out there.
right,
It might limit you and pigeonhole you if you just start an ortho or if you just start an endo, because then you don't understand the other aspect of general.
right. Yeah. Or I'm guessing some people might just fall in love with endo and just love that. Who
Mm-hmm.
was it somebody was saying the other day, with the endodontist, they charge out maybe like 6 codes or something. So,
That's all you need to know.
yeah, just 6
Well, and with
codes.
endo, you might need to know like only 4 procedures. You know, an apectomy or whatever they call it now.
Yeah,
As
yeah,
I call it, a root canal. I mean, on a molar, an anterior, and a bicuspid, So like you said, there's only so much that they can, although some endos are now doing implants of themselves also, but yeah, it's very limited to the procedures. They're not going to do composite or they're not going to do a crown. So they might just say like, hey, I love this. all day long, endo.
Right, and I'm just thinking too, being, working as a office manager at those offices, how, I mean, much more simplified that can be
Oh yeah.
for everyone. It's like you don't have the routing slip. Some offices still use routing
Yeah.
slip, like with all the codes and like the
Yep.
checks next to it of like
And then
what
you make
you're
sure
doing.
you're
You're like,
checking the right code. I mean, is
no,
it, a two surface anterior, three surface anterior? Like,
yeah, and then you miss like a word. Oh, it's got a core buildup, but without the core build, I'm like, oh, I forgot that part.
yeah, or prefabricated, or a, all these terms for post or pre and stuff. And you're like, okay.
True. Yeah. And that's, what we're talking about right now is a whole different area of learning curve. You can learn
Mm-hmm.
all the techniques and
Mm-hmm.
instruments and all the procedures, but then learning all the codes and how to support a team and talking to the patient because much
Yeah.
hygienists, I mean, when the doctor leaves the room, they're talking to you guys. They're
Oh
talking to
yeah.
us.
Yep.
And how do you guys bridge that gap in learning the answers and how to respond to the patient? Is there a way that you guys learn how to do that?
I, for me, the biggest thing was always staying in the room when my doctor was talking to the patient, or often when the hygienist was talking to the patient. I learned a lot from my hygienist on patient communication, past hygienists that I've worked with.
Mhm.
And also my doctor, I worked in one practice for 24 years. So I would always sit and listen to my doctor, how they explained it to the patient, how they wanted it to be explained to the patient. And then, the doctor leaves, and of course, they turn to you and say, "So, what do I need done?"
Right.
And then I was able to kind of replicate the conversation almost word for word based off what they had said to the patient. So I always think adaptive listening, listening to your doctor, no, not leaving that room until that patient is ready to exit, because I feel like you're missing key conversations that your doctor may have with the patient, that if you're new to how they do things or how they like things or how they're diagnosing, I think it's important to stay with that patient and the doctor until they're done having that conversation. Now, and once you get to know your doctor, you can literally know, like, okay, I can look at that x-ray and be like, all right, they are going to diagnose X, Y, and Z, and this is how it's going to go. And the patient's going to be like, okay, so why do I need this? And then you're thinking of that conversation in your head, like, oh, yeah, they need this because of X, Y, and Z. And this is how my doctor is going to treatment. And this is why he's doing it, or they are doing it.
Yeah. And what are the next steps and how long do they need to wait?
Mm-hmm.
What are the list of questions that they're
Yeah.
going to ask? And I love that because I feel like sometimes we exit the room too quickly where the patient's still just taking in all the information and they're processing it.
Mm-hmm.
Wait,
Yeah.
what? Okay, I understand what they just said, but this came out of nowhere. And I
Mm-hmm.
didn't come in thinking that I needed this today. And I have so many questions of like how it got here and why it was just diagnosed this way. And I mean, even if they do trust you, it's
Mm-hmm.
and for the dental assistant and the hygienist to be able to answer those things,
Right.
to continue that trust transfer within the practice.
Yeah. And my habit is I look at the schedule, and I'm a very big on the communication part of it. Is when I'm looking over at my schedule for the day, I will go to my boss, okay, and be like, okay, this patient, we're doing this patient, we're doing this. Okay, this patient's coming in for an emergency on the upper right. They already had this done on the upper right. you know, I kind of play the guessing game, like, okay, it's going to be number 12 and the filling fell out, but they had a large, filling before. We're going to do a crown this time. So I'm going to set up for a crown. Like, I can play the guessing game with how he is going to funnel into the procedure. So I kind of get ahead. And if it doesn't work out, okay, I set up for a crown, no biggie. But if it does, then at least I'm prepared and we can get going lickety split. So I'm a big believer on the best part a dentist and their dental assistant can do is communicate, like talk all the time, about patients, about procedures, about things, because it's going to make them a better team.
Yeah, you guys really are the glue. You really are. And I'm just sitting here thinking as you were talking about like all the setups, I remember because sometimes what you think it's going to be isn't
Mhm.
what it's going to be. And you have like four different kinds of procedure setups just in case it turns
Yeah.
into that. So you don't have to run around, leave the room, wait for something. You can grab something from the
Mhm.
tray if doctor needs it, and that you're always like 10 steps ahead of where you're
Mhm.
going. So I'm thinking about that entry level dental assistant. And, dentistry is the best profession in the world. I mean, you guys,
It is, and people may complain about this or that, but we really do have, we can set our own hours. We don't have to work nights and weekends, and we can charge our own fees, and we can have the best supplies and the best modern technology and the advancements. And we're really not like under the thumb of a lot of other health professions are. So a
mm,
dentist that has their own practice really, you know, is, I don't know. I've never worked for corporate, and I've always worked for the private practice. And I'm like, what would it be like to work for corporate? Where they don't really have like, hey, we can do this today, or hey, let's close the office because it's a snow day. We have that flexibility. So I'm a private type of gal, but I really do think dentistry is one of the greatest professions and that healthcare has to provide. So,
it's we're in that position to really change people's lives through the conversation
hmm
that we have and to
hmm
advocate for them. And, it's up there with, I think the pharmacist is like the most trusted profession. I would say that dentistry is as well. And, we haven't even talked about the anxious patient and them walking into your op and they're anxious walking in to see the hygienist. We know that, but like
hmm
they're going to the operative side, where they're with you and that first connection that you're making and to recognize that the anxiety there and to bring down the levels of that are just they're game changing for that. Whether the procedure goes or doesn't go, what the entire temperature of the room is with the doctor
yeah.
and the entire procedure.
Oh, yeah. And I always approach every patient as if I'm the enemy. Like they hate me, they hate being there. They don't want to be there. They will tell you, oh, they will tell you flat out. They have no problems telling you. So I always approach it as like, how am I going to make this person's day better? They don't want to be either. How am I going to get them in and out of the chair the fastest way possible so
Right.
they can spend less time, not make it painful, help them understand what's going on, and how can I want them to come back? Feel like, oh wow, that was the best dental visit. I want to come back. I want to come back.
Yeah.
You know, so it is. It's so funny. Last week I had a patient turn to me and say, "Are you two married?" And I'm like, "No, I would never marry a dentist.
We're married, but not to each other.
No, I would not. No, no." They're like, "Oh, because the way you were talking to each other." I said, "Oh, that's just the way we talk." I
Yeah,
said,
you spend a lot of time there.
mm-hmm. They were laughing. They're like, "No, you work well together. It's just so funny." I'm like, "Oh no," you know.
It really does become like that because
Mm-hmm.
you have to be able to read the other person's body language. And, as we started out, there's the procedure and getting to know the procedure, then there's the codes, and then the patient, and
Mm-hmm.
there is managing emotions of what's going
Yeah.
on and learning how to read what doctor is thinking, not wanting, like,
Right.
when they're doing like the or the what
hmm
they're doing behind
And
the patient.
and often I think we sometimes as dental assistants we're afraid to speak up of like, I've done this procedure with my dentist 500 times. And, they're still telling you, do this. Yeah, I know, I know, I know. Or they kind of want to shift gears. And I think for me, I've started, years ago, starting to give like not pushback, but like, no, don't touch my side, don't grab things, let me help you. Because I often think that it helps me know the process. And if you interrupt my process, then I'm like, okay, now where am I in the process? You've just grab something off my tray. What did you grab? You know, like it's so just so funny. I'm like, you know, I have to slow the roll, as I call it. And often I feel like dental assistants are afraid to speak up. But I think if we start speaking up chairside, it's not in a mean way. It's more in a way, let me help you. Let's work better together. And it also makes them feel like they're an important part when they contribute to the conversation about the process. So,
Yeah, how do you, I mean, obviously you're not having that conversation in front of the patient, but how would you recommend, because I'm just sitting here thinking, yeah, I mean, you've done the procedure 1,000 times and the doctor's
mhm,
like, next, and they're probably checking off a checklist in their head of like, what's next,
right.
next, but sometimes it's not appropriate with the patient in the chair because they don't want to hear
Hmm.
all that stuff. So how do you kind
Hmm.
of tell them, hey, stop doing that, or I don't need that guidance anymore?
Yeah, I look at every procedure, and I think as a dental assistant, I think we should analyze like how that went for ourselves. Did we do the best job possible? Did we forget something chairside that we had to get up? I remember a long time ago taking a course, and I think it was like Whitehall Management, which is now I think like some other type of consulting company. But they talked about time devotees, all these time devotees, that every time a dental assistant gets out of the chair, it's a minute, 2 minutes, and they're looking for things, they're not prepared. So it's always made me, after every procedure, analyze, okay, we set it for 30 minutes. How much time did we get it done in? Did it go well? Did I have everything out? Was everything set up? Did I had to go in drawers? So I kind of look at that, and then I go back and be like, okay, next time, let's try to do it this way. Or, hey, I'm sorry I forgot the micro brushes, but things happen. So I always kind of think of how we can fix it and make it better for the next time. Or, doc might do something different, and I'm like, oh, why'd you scan after you got the prep done? You usually scan before, why they're getting numb, so things like that, to kind of is a mental note to myself, like after they get them numb, hey, time to scan, instead of forgetting, and then all of a sudden he's got to do the whole thing. So I always make mental notes. I always see how we can be better. If we ran over, if it didn't have enough time, how can we make it better? Besides my dentist, who shorts himself time when he schedules patients. Oh yeah, I can get that done in 20 minutes. I'm like, no, I can't. No, they and I drop down like 10 more minutes. We have to allow for ourselves we're single column, with a little bit of non-productive on the side. So we do have to allow, my dentist has a main assistant, and I'm called the occasional assistant now. And to flip the room, to properly flip the room. And often that doesn't happen. So then it causes the dental assistant to be rushed and feeling anxious, like they have to get to that next room and go and cut corners. So communication, it all stems to the communication
Yeah.
for me.
Yeah, it's having those conversations as well. And I think it would be appropriate too, just like when I encourage the hygienist or any other team member
Mm-hmm.
to have like a debrief to say, how did that go? How we were running 10 minutes behind. What did you see from your side that could have gone differently? I'm seeing that I could have had this, and this.
Mm-hmm.
Could I have supported this differently? But to have those conversations and feel like that you're in the role to have those conversations,
Right.
that that shows them your want to improve, your interest in what you're doing, your I don't know, not loyalty, but your commitment to the practice and to them and their success and
Mm-hmm.
your own success, right?
Yeah. And I think sometimes what happens is dentists tend to pick and peck, and not and not understand that when they do that, the dental assistant feels less, so they shut down. And
Hmm.
then they get this kind of like attitude or resentment. And I've been there. I mean, I worked for my second dentist I worked for, that I was in for 24 years. He was a very old school Italian, beautiful dentist, did amazing work. But he would be like, nope, mix it again. And I'd be like, instead of telling me why I needed to mix again, he'd be like, nope, mix it again. Nope, do that again. Nope, did take it, and I was like, and I would just see myself shutting down.
Mhm.
And finally, until I started asking him, why do I have to mix it again? You need to tell me why. Well, the consistency wasn't right. You had too much base. And I mean, this is when you used to mix on a paper pad the base and the catalyst for the impression material and suck it up into a syringe and then load it into the tray. Now we didn't have these fancy extruder guns. Now we have scanners, so we don't even take impressions. But instead he tried to tell me why that I needed to redo something or why it was like this, made me understand. But if you're just telling me to do something over, or if it wasn't correct, it makes my self-esteem go down and be like, well, he's just nitpicking, or they're just nitpicking, and I'm just going to shut down and just do what I need to do. It doesn't let me take pride in what I do. I feel like it just causes a dental assistant to shut down.
Yeah.
And they may really love what they do, but then when you're picked at the whole entire time and not uplifted to do things better, you just shut down.
Yeah. And I think that's such an important point, Julie, because with
Mm-hmm.
any role, it is, I learned when I was teaching early on that when I gave exact feedback of, okay, this is how the appointment went today with the patient, going back to hygiene school,
Mm-hmm.
I could say that went really well. But when I said I loved your time management because these are all the things that I saw you improve with. That
Right.
while you had downtime, you did this, that you got real specific about the
Mm-hmm.
feedback, about the differences that you noticed with them. And then also some opportunities for growth as well of, you know, I noticed here when the patient said this, you didn't catch that. You didn't catch what they were
Mm-hmm.
saying. And let's talk about what that could have meant. So when a patient says this, what could they also be saying that they're not saying? And it's like, oh, they were saying this. Exactly. Okay, so what
Mm-hmm.
you have asked, and to coach them around in that. And that's when it started to land differently. And I feel like if we take the time to do that, like what was also good, and to give those exact examples. So if that doc said, that time that you did that for that patient, that 9 o'clock patient, that was straight money. That was awesome. Like that was mwah, that couldn't have been more perfect. What I
Mm-hmm.
noticed was that it was the consistency was thinner. It was this and that, whatever, right? And that only took
Right.
you this amount of time. That is the feedback that is so helpful.
Yeah. And I think they call it like positive reinforcement or constructive criticism or whatever terms they have. It's just more of feeling like, okay, I can do this. I might need some self correction and improvement, but at least they showed me how and the why. I
Mhm.
mean, and I think most of the time is we want to know why we didn't do something right, or why were we not getting paid more, or why was the patient late. It's that, not just because. And I think it stems back to like when we were a kid and your parents told you no. They would just say no. Well, why am I not? No. They would never say, you're not doing that because you shouldn't be out at 2 a.m. partying with your friends in a field.
Nothing good happens at that time.
Right, So it's always and then you could say, oh, it's a very unsafe practice, something.
What makes sense.
As it's I think we're creatures that we want to know the why, just like patients want to know why do I need a crown and build up, why do I need that tooth extracted,
Mhm.
instead of having just, oh, well, that tooth needs to come out. They want to know, well, why do I need that tooth out?
That's right.
Can't be restored, decay's gone too far in the canal, it's unstable, it wouldn't be worth the investment, whatever the case may be, we want to know why.
Yeah, and to take that opportunity to
Mm-hmm.
invest in the other person's understanding and the
Mm-hmm.
practice versus just yes, no, yes, no. Now, Julie, you put out a lot of content. Are there any other ways? Like I know that before we got on the call, we were talking about you're developing some digital assets that help dental assistants because I want them to know about what's coming with you because I
Mm-hmm.
know that you're a trusted source in the dental industry. So what kinds of things are you developing that are upcoming and how can they access it?
So I'm trying to finish some digital content where you can download. They're going to be chairside guides from the new dental assistant to the advanced dental assistant, processes, procedures, things that they can customize for their practice. So if it's a new, a dentist that's hiring a new dental assistant, there's going to be a chairside guide for that. They can download it, customize it to their processes and procedures in office so that they have a digital platform that the new hire can go to and learn all those systems. Because there's nothing worse than hiring a dental assistant that has never worked in dentistry and then expecting them to know all this. So I want to have longevity. And I feel like often as dental offices, we hire team members without the longevity in mind. It's just, hey, we need a hygienist. Hey, we need a front desk. I want it to be a career and a career in a practice and find a home, whether you're working in corporate or private, it doesn't matter, but a place that you can go to every day, not just for a paycheck, but to feel like you have a career, and it is a career, it's just not a job. So I'm trying to create a lot of digital download contents called chairside guides for dentists, dental assistants, and then also my product videos. I'm really want to hone in on more product videos because I find it's important that a dentist buys a product or buys a new product and they just put it chairside and be like, okay, we're using this. And you're like, okay, now we can all read. I know we can pull out the IFUs for it, but I want to shorten those terms and be like, okay, this is bond and this is who the manufacturer is. And you need to scrub it for 10 seconds. Then you need to air dry it. Then you need to light cure it. And just that process so you can understand where the dentist is coming from and about a little bit more about the product. So product videos are my new thing that I love doing. I love helping companies with their product videos from a dental assistant understanding standpoint.
That's awesome. What a huge benefit. Just be able to watch something, to visualize it, because most of us are visual learners. We can read, but it's like pulling out the CVS receipt in the background. It looks like it stretches to Mars, and you're like, okay, this is an Russia. Yeah. Which section do I go to? Right. So, yeah. Well, Julie, thank you so much for being on.
Oh, thanks for having me.
Appreciate your time. You guys, if you want to reach out to Julie and check out her resources that are up and coming, and also follow her on Instagram and all of her other socials, her information is in the show notes if you're watching this on YouTube. If not, it's in the Instagram captions. So thank you for all that you're doing, Julie.
Thanks so much for having me. I appreciate it.
What a pleasure. So you guys, you know that I always ask the favor to go on to Apple Podcasts to give the Dental Handoff a 5-star rating, because Apple Podcasts is the one that rates all the rest of them. So please give the Dental Handoff a 5-star rating. And if you're watching this on YouTube, go ahead and press the little like button that you like. And please be kind and do subscribe to the Dental Handoff, and write a little caption to Julie and say, loved your episode, Julie, because that feeds the algorithm.
And love the Dental Handoff.
And we love Dental Handoff. And Julie, you look so good in that green, whatever you want to say to her, but it helps to recommend us to other people who may enjoy this. So to you, our listeners, thank you so much for listening again. Thank you for all that you do. We will see you again next week. Sending love, everybody. Thanks, Julie.